Hi everyone, I'm Dr. Amir Karam. I'm a board-certified facial plastic surgeon and founder and creator of Karam MD Skin. I specialize in facial rejuvenation, which basically means I help people look as young as they feel. And on today's episode of Skin School, we're going to talk about a very important topic, which is microneedling. I'm going to give you the basics of microneedling, but also make a very, very important distinction between regular microneedling and radio frequency microneedling, or RF microneedling. You're going to want to know this information because getting this topic wrong and doing the things that you want to do to improve your skin but going about it the wrong way could actually harm your skin. In addition to harming your skin, could be the difference of a lot of money between the two as well. So let me empower you to be able to make good decisions, and really with that information, you'll be set. Let's just summarize really quickly what microneedling is in general. Microneedling is the passage of tiny little needles into the skin with the intention of causing some injury to the skin and therefore causing the skin to respond by building collagen, right? So you injure, the tissues respond by building collagen, and guess what? Collagen is what makes skin look young. So the whole idea is that because with age, our collagen in our skin is diminishing pretty substantially, especially as we get into our late 40s and early 50s, that we want to do things that are going to stimulate collagen, and microneedling has that intention. Let's start off with standard microneedling. So standard microneedling is something that I actually really like in practice because it is very, very safe, it is inexpensive, it is widely available, and just about anyone could benefit from it. And here's the concept. Basically, there's a device that creates a pulsating penetration of tiny little needles into the skin. When those tiny little needles penetrate the skin says, uh-oh, I got injury, and now I need to respond. Build up scar tissue, which is basically collagen. That is the cycle that you want to initiate in an aging skin, is you want to basically say, all right, so I know, my fibroblasts, which are my cells that are creating collagen, are basically starting to retire. They just don't want to build any more collagen. So instead of accepting that, I'm going to basically make them create collagen. I'm going to incentivize them to create collagen because I'm going to do something that they inherently respond to, which is injury. That's the whole concept. And once you do this procedure, you want to do it on a regular basis, because what good does it do to get a spike of collagen production and literally not do it again? Because what will happen is the minute that spike happens and you develop all the collagen from that initial event, well, guess what? It's going to start to diminish shortly thereafter. So you'll be back to square one, in other words. So the ideal approach with standard microneedling is once every 6 weeks, once every 12 weeks, you go into your dermatology practice, plastic surgery office, medical spa, esthetician, and you get microneedling done. Caveats here is that you want to make sure that you're using sterile techniques and sterile equipment. So these tips that are available on most microneedling devices are not reusable. They have to be thrown away. You want to make sure you're practicing at a very reputable location where no shortcuts are made, no cost-saving approaches are made, and the technician really understands proper sterile or aseptic technique so that you don't run the risk of getting infections and things like that that can happen from either driving bacteria into your skin, or God forbid, you're in a situation where it's used in one case, they don't realize that they didn't change the top, and then they put it into another case. Now, these things can obviously happen in poorly run and loosely run establishments, but they really shouldn't happen in a well-established and reputable location. So just don't be haphazard about it. Make sure always at the top of it, safety is first, and safety starts with the person who's actually doing these procedures. But the reason I generally love it is for the reasons I outlined. It is a very, very good addition. Note that I said good addition to standard, solid, consistent use of skincare. And I've talked about this before, so check out some of my other videos of what encompasses what your daily approach should be. But this is a great enhancement on top of your daily sun protection and daily skincare. So now let's talk about radio frequency, or RF microneedling. So radio frequency is basically it's a type of energy that either is going to pass between the needles or is the actual needle is going to be charged with this energy. And so when the needle goes into the skin through an RF microneedling device, in addition to creating the mechanical injury of the needle penetration and the collagen stimulation that comes from that, you are effectively creating a kind of a thermal injury or some type of a heat-based injury that is going to hopefully increase, or this is the intention, increase the response of collagen. And the idea is that because of that passage of radio frequency, that you're going to get a tissue shrinkage type of an effect, which will tighten up the skin a little bit and improve things like fine lines and wrinkles, acne, scarring, anything that basically requires a little bit of like decrease. So in our practice, I have both standard microneedling and radiofrequency microneedling, but there are some caveats with radiofrequency microneedling that I want to make sure you totally understand. And this is very, very important because they're very popular, and some of the common devices are like Morpheus 8 and these other devices. So here's what radiofrequency microneedling and how it should be done. So basically, the sweet spot that you're trying to deliver that energy is within the dermis of the skin. The skin of the face is anywhere from basically 1 millimeter to 2 millimeters in thickness. In areas like the lip, it's closer to 2 millimeters. In other areas, it's closer to 1 millimeter. You want to deliver that energy no more than 0.5 millimeter, at the most 1 millimeter into the skin in the deeper areas. Why is that? Because what's beyond the skin is subcutaneous fat, which subcutaneous just simply is a fancy term for underneath the skin fat. Underneath the skin fat functions like a padding which holds the skin and puts it into kind of like this nice supple, full look. It's like the foundation of the skin which it lies upon. If you shrink that layer of fat by disposing energy into that, right? That's what happens when you put heat on fat. It basically creates a melting effect. And when you do that, what you will end up causing is fat loss. And this is something that a lot of patients, a lot of people, not only my own patients that have communicated with me about this issue, that they did a radiofrequency procedure and it melted their fat and their face actually looked older. Now that's like the worst thing that could happen, right? You go get something that's supposed to make you look younger, but it actually makes it look older. So how do you avoid that? And this is really, really important. The way you avoid that is not to fall for the notion that you're using radiofrequency microneedling to tighten up a loose face, right? What is a loose face? It's like jowls and neck laxity and all the things that really, simply put, require surgery, require facelift, require vertical restore. Those are the things that you don't want to try and treat with a radiofrequency device, because when you try to do that, the technician is going to dial up the device and it's going to be putting that into the 4 to 6, sometimes even deeper millimeters, trying to attack the fascia. And the problem is, not only are you going through the skin, but you're also going through the fat and trying to get to the fascia, which you rarely get to. And as a result, you're delivering all that energy into the fat. That is a fundamental mistake of radiofrequency devices that are too deep. I think they have absolutely no place in the toolbox for facial rejuvenation or skin rejuvenation, although I do think that a properly done radiofrequency device that is held within a 0.5 millimeter to 1 millimeter max can be very, very useful for people who have more advanced crepiness, fine lines and wrinkles, acne, scarring, and more skin change that needs to be addressed. Now, don't expect miracles with either of these approaches. Truly do not expect them, because these are procedures that are not going to, they're not like surgical treatments that are going to change your life in the way you look in one treatment. These are things that once you decide you're going to go down this road, you're going to be doing them on a relatively regular basis. Now with radiofrequency devices, I wouldn't do it every 6 weeks unless you're doing a series to try to get things going. But you would probably move towards like every 12 weeks, twice a year, that type of thing. But again, talk to your provider, because there are protocols that sometimes you use for certain type of conditions that you want to do a series of them back to back and then get into a maintenance protocol where you're doing them a little bit more widely apart from each other. Now again, I'm a total advocate for standard microneedling, and I'm an advocate for radiofrequency microneedling when it's done with the right depths. We use them in our practice. We have been using them for years. We have no problems with them from that perspective. But again, you got to be careful about this fact. And this is something that a lot of your providers may not honestly know. This is where your knowledge can be even, in fact, more beneficial because you're going to advocate for yourself and you're going to inform your provider not to try to go deep because of the concerns that you have. And if you want to have them refer to anything, refer to this video, and again, a lot of the previous videos that I've made on this particular topic, and read what is the community response to these experiences with Morpheus 8 and some of the other RF devices. And I'm not trying to pick on Morpheus 8 because that's just one of the many RF devices that can be dialed up to a much deeper level. It's just one of the most popular ones. It's one of the ones that is most synonymous with radio frequency. That's why I mention it. And again, this is just my observations and opinions about the topic. As a surgeon, I'm dealing with patients who come to me and give me their entire history of the things that they've done. And so many of them come in with regret on this deep RF microneedling aspect. So I want to help you avoid that the best I possibly can. Again, spread this word, spread it out as much as possible. It's very, very important that we help inform everyone. Now, again, just to summarize, the hierarchy of skin anti-aging comes down to sun protection, comes down to daily use of retinol, vitamin C, niacinamide, certain types of peptides, and things that decrease pigmentation. The daily use of skincare is very, very important. And then you move into microneedling and these other treatments and lasers and all this other stuff to give you enhancement above what you're getting with those foundational treatments. All right, folks, that is it. I hope you enjoyed this. I hope you learned something. If you haven't already, hit subscribe. Follow me along. Every week I put out an educational video on facial or skin rejuvenation. Also, make sure you subscribe to the Karam MD Journal, which is a wonderful newsletter that comes out every Saturday and gives you a lot of good information about topics similar to this, but a little bit more in depth. If you have any questions or comments, drop them down below. I'll do my best to answer as many of them as I possibly can. And if you enjoyed it, hit like. Until next time, Dr. Amir Karam.